Hello friends, today we are going to discuss about Allied and Healthcare Professions Law. I am Dr. Suresh Badadmat, Professor of Psychiatry working at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic and training purpose only. This presentation is not a substitute for professional legal opinion. If you want to have a legal opinion, please do contact an advocate. The National Commission for Allied and Healthcare Profession Act 2021 was recently passed in the Parliament and also received the President's assent. What was the need for this legislation? And whom does it apply? At the same time, this video will be helpful for those people who are working in the health sector, the students who want to make career in the area of allied and healthcare professions. So, my dear friends, please do keep watching till the end. The background. The COVID pandemic clearly opened the Pandora box of public health sector in India. Not only public health sector, even the private health sector. There was a huge demand on the healthcare professionals. Burnout, death in the healthcare professionals, and various other challenges were faced during this pandemic. Whenever we say health professionals, everybody will think of either the doctor, nurse, maximum. At times, pharmacist and dentist. But unfortunately, there is a large group of other healthcare professionals who are invisible. They're not to be seen at all. There are 56 professions which are there. But they are unaccounted. They have not been registered. They have not been given due credit. This is unfortunate. And this registration means, for example, for doctors, there is National Medical Commission. For nurses, Nursing Council of India is there. For the dentist, Dental Council of India. Pharmacist, Pharmacy Council of India and Rehabilitation Council of India. For these 5 professions, there are 5 councils. But there are 56 healthcare professions present in the country. Unfortunately, there is no council to regulate them, to register them, to recognize them, to give them an equal platform so that they can come forward at the same time, serve equally in the health sector. And not only this, their institutions are not regulated, curriculum is not regulated, the entry and exit exams are not regulated, and the curriculum is not structured, core competencies are not discussed. And unfortunately, healthcare is becoming advanced, more complex, highly technical in nature. The doctors and nurses cannot comprehend this technology. They require support, not only in terms of using this technology, but at the same time, they require support in providing healthcare, not only in the rural area, but also in the urban area. If you look at the Boer Committee in 1946, they clearly said that not only doctors and nurses, the support staff also need to be trained, and also we need to have good institutions and also the mechanism to harness them. Unfortunately, nothing happened from 1946 till 2007. But however, there was an attempt in 1994. After that, there was a paramedical and physiotherapy central council bill in 2007. Unfortunately, this bill got lapsed. Again in 2011, National Commission for Health Resource for Health bill was also passed, was pending in the parliament, but nothing happened. After 70 years, the new law came in. And why this law came in? Look at the number of specialities in allopathy. There are more than 45 specialities, post-graduation, and each of these post-graduations are regulated under Medical Council of India earlier, now National Medical Commission. The entry exam, exit exam, UG exam, PG exams, everything is regulated. Not only that, even the medical colleges are regulated, and also they have been given clear minimum standards to maintain. Hence, the doctors of our country are well recognized outside the country also. Internationally, they have been recognized. Unfortunately, the healthcare ecosystem is not developing in India. At present, healthcare ecosystem is complex, has a complicated technology, And now it is consumer oriented. The consumer wants everything at his doorsteps, or else everything should be available at the hospital. And the doctor and nurses requires assistance from multiple domains, not only filling the time, and also they require help from various other technicians. And each branch of medical science is growing with a rapid pace. Doctors and nurses are unable to catch up immediately, not only in their field, even in the allied field also. And challenges are numerous, but at the same time, opportunities also numerous. WHO clearly said that health system or healthcare system can only function with the presence of health workers. Improving health service coverage and realizing the right to the enjoyment of highest attainable standards of health is dependent directly on the availability of the healthcare workers, accessibility to these healthcare workers, acceptability and quality of these healthcare workers. But unfortunately, there is a shortage of healthcare professionals across the world. World Health Organization estimated approximately 18 million healthcare workers are required by 2030. And the good news is 60 to 70% of these healthcare force is women. And this is an opportunity for India to harness this amazing allied healthcare professionals opportunity so that we can employ our women and also make our society more vibrant. At the same time, we also have a mandate for our nation, that is universal health coverage. Under Ayushman Bharat, we have made two important promises. That is the two pillars of Ayushman Bharat. One is providing primary health care and also providing care at the doorsteps, that is health and wellness centers at each sub-center, so that the patient need not travel. His treatment is available near to his village. Not only that, if the person requires secondary and tertiary care, that will be covered under Pradhan Mantri Jan Arogya Yojana, well known as PMJAY. And these two important pillars of Ayushman Bharat again requires not only finance, the important is healthcare force. Without health force, again this cannot be implemented. The implementation of universal health coverage means accessible to everyone. That is, healthcare should be available to everyone, available across the country, affordable to the poor, acceptable to the community, adequate in quantity and quality ensured. Unfortunately, this cannot be done only with doctors and nurses. We require supports from all other healthcare professionals. There are 10 different categories of healthcare professions have been recognized, which caters for 56 healthcare professions. These 10 are medical, laboratory and life sciences, 1. Second, trauma, burn care and surgical anesthesia related technology, physiotherapy professionals, nutrition science professionals, ophthalmic science professionals, occupational therapy professionals, community care, behavioral health science and other professionals, medical radiology, imaging and therapeutic technology professionals, medical technology and physician associates, health information management and health informatic professionals. These are the 10 different categories which have been categorized and which encompasses 56 health professions. There is a huge gap. This need to be filled. The reason being is these 56 health professions need to be regulated. Hence, the new legislation came into force, and that is going with an objective of training institutions need to be regulated. Unfortunately, at present, they are not regulated. Minimum standards should be put forward. Registration of these institutions, inspection of this institution, how many students they can take, the number of faculty should be how much. At the same time, that is about the institution. At the same time, entry and exit exams for the students also should be uniform across the country. The curriculum for the healthcare professionals should be regulated, which at present is not regulated. Not only curriculum, the core competencies, skills, course duration, and update of the skills also is required. Registering all these professionals has to be done, both at the state and the central level. At the same time, we need to clearly say what they can do and what they cannot do. What are the tasks that can be shifted to them and they can do at the rural level, at the taluka level, at the district level. At the same time, under the supervision, what are the duties they can perform? At the same time, professional ethical conduct also has to be regulated. The reason being is they are going to be within the healthcare system. In this ecosystem, they have access to very important or sensitive confidential data of the patients. Hence, there is a need for professional ethical conduct. Last but the least, it is the research which also need to be harnessed. Not only this, all these 56 professions need to be coded as per the International Labour Organization. That is, the coding is called as International Standard Classification of Occupations. And most of these 56 professions have been clearly coded. Hence, the once this education is regulated, the curriculum is regulated, core competences are clearly mentioned, and their education system is well regulated, just similar to the doctors who have been recognized across the world, the paramedical health professionals also will be recognized and they will be hired by various other countries. That means they are not only required within the country, but also outside the country, they have an amazing opportunity to perform their duties. Hence, with this objective, the National Commission for Allied and Health Professions Act 2021 was passed in the Parliament. And it was passed on 28 March 2021. And this legislation received the assent of the President on 28 March 2021. It has 8 chapters and 70 sections. And clearly it has 3 important central statutory bodies, which are basically advisory and setting standards in the center. They are first and the foremost is National Commission for Allied and Healthcare Professions. This is more of policy making minimum standards, setting up rules and regulations. Apart from that, they do not do much activities. Professional council will be done for every profession. At this point of time, 10 professional councils will be formed under the legislation. At the same time, National Allied and Healthcare Advisory Council is also will be set up, which consists of the chairman and the vice chairman from the National Commission and also from the State Commission. So, the seamless coordination occurs between the state and the center. But the state is going to play a crucial role, not the center. Center is more of advisory role. The implementation occurs at the state. The state has to form State Allied and Healthcare Council. This council is the implementing agency at the state. The reason being is there are 56 different professions, n number of colleges, various different curriculums are there, and various durations are there. These need to be standardized. And hence, there will be an interim commission will be set up, which is looking to this matter, and minimum standards will be clearly set up. Once it is done, the 4 boards will be formed across every state, and UTs will be subsumed under the respective states. That is Union Territory. The Union Territory will not be looked after by the center now with regard to this legislation. And the 4 boards, one is undergraduation board, which looks into the education of the undergraduate allied and healthcare professions, post-graduation board, assessment and rating board, ethics and registration board. So these 4 boards of the state is going to be play a crucial role of this legislation. Not only this, the state also will have an advisory board in every state. And these advisory board, the state can decide how many members they want depending upon the professions. They will form this advisory board so that the State Allied and Healthcare Council can implement this legislation easily. To conclude, my dear friends, there is an immense demand for the qualified healthcare professionals, not only in the country but outside the country also. This legislation, which has been planned and passed in the parliament, will provide a necessary impetus in providing affordable healthcare to the people inside the country and also outside the country. And Indian healthcare professionals can play an excellent role in the international forum also. And this legislation is going to be a landmark legislation with the paradigm shift which is going to occur, where the healthcare was revolving around with either the doctors and nurses. Now it's going to be a comprehensive team-based approach to give a holistic healthcare. Thank you very much for giving your valuable time. Stay safe.